My name's Anil Bangu, and I'm a colorectal surgeon in Birmingham. And I'm also the chief investigator of the COVID Surge Collaborative, which is providing evidence and guidance for patients and surgeons during this pandemic. It's a pleasure to be here today on behalf of Bowel Research UK and to be really having a conversation about what this all means to patients and what the future looks like. And I'm joined today by Leslie.
Hello, I'm Leslie. I'm Director of Research and PPIE at Bowel Research UK. I'm also the first patient that the charity has employed. PPI for me is both a rebuke and a reminder that funders, health professionals, researchers, public and patients need to work in equal partnership to co-produce meaningful and powerful research impacts. The patient advisory group that we set up for COVID Surge did exactly that. And one of the participants who took part in that program was Carrie.
Hi, my name is Carrie Tierney. I'm a patient in Bowel Research UK's group of patient and public involvement. I had major bowel surgery a couple of years ago, and once I was recovered from that, I was really keen to get involved in something that I could give back to the community after I'd received such wonderful care.
Thank you. And it's a pleasure to welcome Neil as well.
Oh, hi. My name is Neil Barker, and I'm a patient expert who participates in public patient research with Bowel Research UK. And my journey here is that I was diagnosed with bowel cancer some years ago and successfully navigated that route, and also have lived with Crohn's disease now for over 30 years. So I'm extremely passionate about the work that Bowel Research UK do, and jumped at the opportunity to become involved in some of the PPI work that Leslie has allowed me the opportunity to join in on. And I think it's absolutely crucial that we work with researchers to provide a better future for others.
So this pandemic has brought a lot of change for all of healthcare, but we haven't often spoken to our patients about what that means for those who are waiting for an operation or those who have to undergo an operation. So Carrie, to start with you, could you give us your views on what you think the main anxiety is for patients as this pandemic has unfolded and is unfolding?
It's really hard to pin it down to one main anxiety. I would say there's several personally, but if I had to choose one, I think up there is the uncertainty of everything and the sheer anxiety over what it means about keeping safe, and being safe, and how that would impact any surgery that you may have to have during a pandemic. I think there's just so many things that just would make one very anxious. And I think keeping safe and what would happen, what wouldn't happen, all the things that we included in our patient information booklet with COVID Surge.
In your experience, Carrie, do you think patients and people are worried about coming into hospital for an operation more so than they were worried before the pandemic?
I think people are absolutely terrified. Naturally, I don't speak for the whole public, but certainly anyone that I've come across, friends, family, or just anecdotal or reading on social media, and the work that we have done in the patient and public engagement group, people are terrified because this is a killer virus out there. It's not gone away. And it's a very scary time for everyone concerned, including I'm sure people who actually work in hospitals or work in healthcare themselves.
And Neil, just to pick up on that, so people are having to come into hospitals for still having to come in for diagnosis and operations, and things like they need their bowel scopes to diagnose cancers, for bowel cancers. Do you think patients should be worried, or do you think it's time to come back into the hospitals for those?
Well, firstly, I think it is time to come back into the hospitals, and I was reassured after participating in the COVID surge work that your hospital has been working on the public booklets. As a Crohn's disease patient on immunosuppressants, there is certainly an anxiety, because whilst I feel that I'm fit, I also am concerned that my immune system is compromised. But I think if you actually need or have the need to go into hospital, whether it's for a scope or for a procedure, the risks of not actually having the scope or going into the procedure would outweigh, in my opinion, the risk represented by COVID. And I'm pretty satisfied that most hospitals have got the right protocols in place to make sure that people, should be safe.
So Leslie, we've highlighted there that people are going to have to come back into hospitals, and what we want to do is provide more than just an opinion now. So what you did is you took the COVID surge data, and working with Bowel Research UK, you produced this booklet. So what did you actually do to make that, use that booklet to reassure people? How did you produce that level of reassurance?
Yes, what we wanted to do is work with patients who had direct experience of surgery, and were also being seen in hospitals for ongoing treatment. So they could really look at their past experience to inform the researchers about what both the anxieties that they went through pre and going through their surgical process in normal times. And then we layered that to help the researchers understand how that could be perceived in the pandemic, and the additional concerns and worries which both Carrie and Neil have talked about. So we had a small group of patients that had the space and the time to interact with Mary Venn and her team in a very short period of time, to sit down and discuss with them, to provide what I like to call that we really are story experts of our patient lives. And we served a very specific purpose to help validate some of the data that are being pulled out from the COVID Surge project. And then that helped co-produce the booklets.
So Leslie, if I'm going into hospital and I want to read these booklets, do I have to pay for them? Do I have to find them? What?
No, if you're going to be referred into hospital as a patient expecting surgery, depending who is your first point of contact, they should either be able to give you a booklet, post it to you, or actually direct you, if you have the facilities for online, to download it online.
And I think they're freely available online.
They are freely available online, yes. Yes, so some of the consultants were thinking that they would actually download them in hospital for patients to be handed them at the point if they were able to have a face-to-face consultation.
So those leaflets can be found on the COVID Surge website on the patient-facing page, and they're also available in different languages, aren't they? That's
right, yes. The COVID Surge team have translated them now, I believe, into 13 different languages.
Oh, that's amazing, actually. And how long did it take you to produce those? Because normally producing a patient booklet takes a long time.
I think, Carrie, Neil, it took us 2 to 3 weeks from the initial. We were really rapid, which we were an impressive team of patients.
Well, I think that's the fastest I've ever heard for especially for a surgical topic. You've gone from research outputs after the first publication in the Lancet from the COVID Surge group to patient-facing material in 30 days. And I think we should be very proud of that, because I think that's an amazing achievement. So with the pandemic, we have had a massive shift in the work before an operation, a lot of which is now done virtually via the telephone and via the video. So within the hospital, that's been a major change for us. But I'd really like to hear what size of change it's been for patients in the community. So starting with Neil, has the shift to a virtual clinic setting and virtual outpatients been a big shift for patients, or a little shift?
I think it's quite a big shift in that it's new, and it's something that wasn't previously done before. But on the other hand, it's actually a welcome shift. I think the opportunity to have that session online, I'd imagine, is probably more time efficient from an NHS viewpoint, and it certainly is very efficient from a patient viewpoint. And when I really look at it, I think I have enough trust in my clinicians for them to actually make the decision as to whether they would actually need to see me or not. So I, for one, think it's a winner, and I'll actually hope it continues once this crisis eventually abates a little.
Would you give anyone advice if they've never done a video call before, but they have to have a video call with a surgeon they've never met? Would you give them any advice in how they should be prepared for that?
Yeah, well, two things. One is to be prepared for the technology. So as long as you have the technology, have 1 or 2 dry runs beforehand. Normally we've got friends or family we could do that with. That'd be the first thing. The second thing would be to take the opportunity to prepare some questions that you'd actually like to ask, given the upcoming appointment. So those would be 2 things. Prepare the technology, and also make sure you're in a comfortable place for that as well. Somewhere that you're not going to be disturbed, somewhere where there's not too much background noise. And but then actually have some questions. I think that's very, very important. You've got a great opportunity to ask those questions, and you've got them written down. You're probably more likely to have prepared them than perhaps if you go on a traditional appointment.
Carrie, we've got 2 options in how we virtually speak to patients. That's really with the telephone or video. And both of them have upsides and downsides. From your point of view, how would you prefer to speak to your surgeon?
I don't mind. I mean, during this pandemic, I've had 3 communications with my team that look after me. 2 were video, and they were really good. And 1 was telephone. I have a telephone one coming up next week. So I think it depends on the situation and depends on the person. But generally speaking, I think where you have a situation that you need someone to actually look at you physically, rather than, obviously they can't examine you. But if the situation necessitates that, then I found the video really reassuring. And the only difference between that consultation and one where I would have gone to the hospital would have been that, someone actually physically examines me, and at this stage in my care, it wasn't really urgent that someone needed to do that. So the video worked really well for me, but telephone is good as well. And I totally agree with Neil. When I had my telephone appointment, I made sure that I had what I wanted to ask, and I had a pen and pad, and I felt that I should respect the time that was being allotted to me, and I should actually prepare for it more. And I think some people do that. I am one of those people, but not everyone does it. So I think some good guidance that could be incorporated into that kind of communication in future would be some suggestions. You may want to do this, you may want to do that. So both of them worked very well for me.
I'm picking up on one thing you said, Carrie. Do you think patients should be prepared to whip out their tummies for their surgeon if they ask? Is that a possibility? Does it happen on the video?
Well, for my personal opinion is, why not? Because if you're in a consulting room, unless you specifically ask for chaperone, that's what you would be doing anyway. And if a surgeon or any medical professional wouldn't ask to examine you if it wasn't necessary. So I believe that if people can actually feel comfortable and just have a readjustment to the new procedures, the new normal, if you like, then I think, yeah, I think they should. I would.
Leslie, it's a tough question, but I'd just like to hear your thoughts on whether you think that video and telephone have changed the relationship with the hospital professionals, both the good things and the bad things. Do you think, is it the same relationship, or is there a change?
I think that is a very good question. I think there are both good and bad. I think for patients that have got an established relationship and rapport with their medical team in hospital, it maintains that very positive relationship. I think it also provides a safe environment for the patient and less stressful. With bowel conditions, one of our biggest anxieties is that we are going to have an accident trying to get to you in the hospital, so that puts a lot of pressure on us. So having telephone or video conversation at home mitigates against that. And the consultant comes into our home, so there's an equaling, a leveling, I think, that we can have a more equal partnership, perhaps, type of conversation within the consultation period, because we are both looking at each other through a video conference call. I think for some patients who are not as keen on using modern technologies, who have perhaps not visited their consultant in face-to-face, are used to very much a face-to-face environment, they might find it challenging. So I think Carrie's idea of perhaps how to help those people who aren't as savvy with this medium, to give them the support, because actually it does offer a lot of very positive benefit to patients to take control, because you have the time to sit in your house to ask the questions, and the consultants actually give you the space and the time to talk to you one-to-one, or if you have a family member that wishes to be brought in.
Leslie, even as the COVID rates are up and down in the community, before a big operation, I'm still offering my patients the chance to come into hospital to meet me, and I like them doing that. I like establishing a relationship. Is that still a reasonable thing for me to offer? Or
absolutely. Yeah, absolutely.
Yeah.
I think when the decision to have my colon removed, I needed to sit with someone face to face, because it was such a big decision. I'd had other major surgeries in the past, but this was the biggest surgical decision I'd ever made. And it was so important for me to be able to have trust and confidence and to build up a rapport with the surgeon, albeit for a short period of time. But I felt that was very important. And also it was very important that my family could also sit, because when you are being told about surgical procedures, you're often quite stressed and not taking it in. So to have other people around asking the questions that you may not be picking up and indeed not listening to is really important. So yes, wherever possible, I think seeing you face to face is very important indeed.
And Carrie, before a big operation, it's the same question. Before a big operation, I like to bring patients in at least once to see me, even with the COVID rates up and down. From your point of view, do you think that's still a reasonable thing? And should patients still take that opportunity if they want it?
I think if you're having a major operation, to have that opportunity offered to you, it is excellent. You know, I would have wanted that. If I was about to embark on the journey that, you know, I had a couple of years ago, it's just so major, and you need that face-to-face reassurance. And also sometimes as well, you know, you then need to go elsewhere in the hospital if appropriate to see X person get some information to do some, as part of that first consultation. So there are some practicalities there as well. So if I'd been offered that opportunity, I would have weighed up, like Neil said earlier on, about the risks of visiting the hospital versus the risks of, what we're facing within COVID. I'd be looking for that reassurance and that feeling of safety that the hospital would be providing for me.
Neil, if a patient has to come into hospital, either to see their surgeon before an operation, or to go for a scan, or to see an oncologist, so that they really have to come in, what advice would you give them about preparing for that? Do patients need to prepare for that trip? Do they need to read all the rules around socially distancing and masks, or because it's a hospital, can they just come in?
Well, my recommendation would be to read the COVID surge booklet before you come in the first instance. That would be the first thing. The second thing is, I think it is unavoidable, because certainly before my surgeries, there was the need to have scans, need to have other tests, and also at some point the surgeon has to get hands on and actually have a look at what it is that they're going to be doing. So I definitely would still want to go in if I had to face the same surgeries again. The second thing I think is that have some faith that the hospitals are doing the right thing. When you receive the appointment through, or in whichever way you're invited for that, there will be very clear guidance contained within the letter as to what it is that's expected of you. But also there's reassurance in that when you do actually get to the hospital door, the signs are loud and proud on the doors. And if for some reason you have forgotten your mask, they've got a mask there, mask there for you to put on. So there really is nothing to be concerned about. And I think the risks presented by not taking the opportunity to have the treatment that you need, far outweigh the potential risk of catching COVID through such a visit.
Leslie, the construction of the patient booklets, which are available on the COVID Surge website, is the fastest we've seen patient-facing material coming out of a research study, and it's been quite amazing. How did you produce them so quickly?
We were very lucky to work with a great research team, and also because I work very closely with our own patient and research network, I was able to quickly pull together patients that were available to take part in the Zoom calls. There had been a lot of work done to highlight the areas of information that patients could possibly need. And so we were presented with a very, very, very draft outline booklet. And the Zoom meetings worked extremely well because we could see what the researchers were thinking about. We could comment live, as it were, and the team member was able to alter the booklet as we made recommendations. We discussed color, font, photos. We also inputted into how many booklets there should be, because the researchers hadn't completely thought about that. But the people such as Carrie, and she'll be able to talk much better about this, had specific areas of expertise which enabled us to take the original booklet and to look at it in a completely different way for those patients with significant learning disabilities, which was a major addition to the suite of booklets. So, Carrie, do you want to talk a little bit more about that aspect of it?
Yes. When we were producing when we first started looking at the booklet, I have to say there was so much work done already. Really, a lot of hard work had been done, so you could actually see that. So it was a pleasure to start off from that footing with the research team who had already worked on that. I mean, I'm involved in my professional life in communications, but I do have a particular area of expertise, having worked with people with learning disabilities for some years. And so it was just a natural progression for me to look at it in that way when we were looking at which audience we would actually be targeting. And of course, we're targeting everyone, because someone needs surgery at some time. And, you know, bowel disease, bowel cancer, etc., doesn't differentiate as to what kind of person you are. So that's what jumped out at me when we were actually thinking about who would be reading the booklet, who would be looking for the support. And I just used my professional experience to come at it from that angle.
Neil, do you think that Bowel Researchers UK's existing investment in patients and patient experts and patient-facing materials, do you think it both enabled this to be done so quickly, and do you think that makes it a worthwhile investment?
I think it's a very worthwhile investment because Leslie has a vast database of people such as Carrie and myself, and so for any given project, she's very quickly able to access her database and choose the right people for the right task. And probably Carrie and I had expressed an interest, or certainly both worked on other PPI projects involving written material, for instance, that perhaps led her to choose us to be involved in this particular instance. And certainly in my past, I've been involved in some work with BAME communities, and the style of the booklet, looking at more of an easy read format or having that as an option, is something that can be extremely effective. And they say a picture paints 1,000 words, and I think that's right. So the fact that there are a number of us collaborating, and as Leslie said, you've got Mary and the team so responsive, and the person who was actually amending the material as we went, that was absolutely incredible. So it wasn't a case of, we'll have a meeting today, maybe 2 weeks later you'll get something back to look at. It was almost instantaneous, or indeed you'd receive a new PDF later that day. And that was incredible to be part of something, and to compare the very first draft to the actual final draft, which was only a matter of days later. It just goes to show the power of the professionals working with Bowel Research UK, and of course people like Carrie and myself. So definitely worth the investment, yes.
And Leslie, do you think you would have been able to bring this all together in such a short time frame if it wasn't for the pre-existing and new investments from Bowel Research UK?
No, I think since my time within the charity over the last 2.5 to 3 years, it has allowed us to build on what was there before, and to use that strength and deep knowledge of Bowel Research UK's patient network meant that we could move very quickly indeed. And I think the other thing that was of equal importance in this project was that this research was a real partnership between the research team and also the patients. We were completely equal, and both sides, actually I should not even use the word sides, the whole team worked together constructively to listen to each other, to take on board each other's ideas, and the respect amongst all of us for each other and what we were trying to achieve was really significant.
Carrie, patients have been worried about going to their GPs and going into hospitals, and the number of patients who have been coming through with suspected cancers has generally fallen. So if a patient has something like bleeding out of their bottom, should they continue to wait, or is now the time to see someone?
Please don't ever wait if you ever have that symptom. You're never too young to have symptoms of bowel disease or bowel cancer. And having had bowel disease for many, many years, and thankfully narrowly missed having bowel cancer myself, I cannot emphasize deeply, madly, passionately, from the bottom of my heart, please, if you ever have any of those types of symptoms, please don't wait. Visit your GP or speak to someone medical ASAP.
Neil, some patients who have symptoms of bowel diseases, like changes in their bowels and bleeding out of their bottom, they're thinking about leaving it until after winter's over. So when the worst of the winter illnesses are over, do you think that's a good strategy, or should they be seeking help sooner?
Well, first of all, I think it's a very, very bad strategy, and they definitely should be seeking help sooner. It is a fact that with bowel cancer, the best chance of a cure is early diagnosis. And we've already seen, and it's been on the news quite a lot over the past 2 or 3 months, with real life cases of people who have had their test postponed or their hospital appointment cancelled. And when they finally then did get their appointment 2 or 3 months later, their bowel cancer had actually gone from potentially being curable or being treatable to have reached an advanced stage, which then would make any chance of cure much, much less likely. And that has happened in the space of a few months. And so definitely I'd echo what Carrie said. If you have symptoms, get to the doctor straight away. Having had Crohn's or having got Crohn's disease and having had bowel cancer, I can certainly tell you that if you have an urgent need to get to the loo, as indeed many of us have, then probably the most embarrassing thing is to have an accident when you're driving the car, and so therefore to actually go to the doctor and explain the symptoms that you're having is a much, much easier thing to do. But again, get it looked at sooner. If you do have bowel cancer, much greater chance of a cure. Don't delay, make an appointment today.
Leslie, as lockdowns come and go, if I had changes in my bowels and bleeding out of my bottom, is it worth me having a telephone conversation with my GP, or is it better for me to wait for the lockdown to be over?
No, please do not wait for the lockdown to be over. If you've got any symptoms at all, bleeding from the bottom, altered bowel habits, the best thing you can do is call your GP, because it's only through early diagnosis that lives can be saved, and also lives can be improved for the better if you've got benign disease. So by sitting there hoping that either it'll go away or the pandemic will be resolved through a vaccination in the future means that you yourself are putting your body at risk.
Neil, it's great that patients have taken part in the COVID surge studies, both by contributing their data and also in production of the patient leaflet. Although a lot of research actually shut down during COVID, it's going to start reopening. Do you think, is research a good thing for patients to be going into?
Definitely, research is really important to get involved with, and I would urge anyone who has the opportunity or received an email from Leslie to say yes and get involved. It never has been more important and more needed that we do so. And as we've seen with COVID surge and some of the other collaborations that Leslie has set up with various bowel disease research projects, we really can make a difference. And so yes, do it, and you'll probably then become a complete convert, as indeed we are.
Leslie, Bowel Research UK are supporting a range of both COVID-related and non-COVID related research, and I think we'll see these projects for some time to come. During this pandemic era, if patients are offered the opportunity to go into research, is it a good thing to do? Is it a safe thing to do?
Yes, it is. It is a very safe thing for patients to be involved in research during the pandemic. Most of our focus groups now take place via Zoom, and it allows patients this space in which to talk about their experiences, to support research in a very safe environment. And actually, it allows both the patients and ourselves to look at what it means by taking part in research, because it means that we have the potential to enforce narratives that portray illness experiences as motivators for social action and change, which is what is most important, and which we demonstrated here in the production of the COVID surge booklets. Because at the end of the day, Bowel Research UK's PPI, its involvement activity, is all about improving the health and experiences of services to patients, their relatives, their carers, and users of all health and social care services, as well as to the wider public. And I think that's once again what we really have just demonstrated through the COVID surge patient booklet project.
Leslie, the UK has led a lot of research throughout the pandemic, and I think we'll see that continuing. In terms of bowel research, it's really organisations like Bowel Research UK who are pushing forward and will be pushing forward. So if patients are offered the opportunity to go into a study that's been sponsored by Bowel Research UK, Carrie, do you think is that a good thing for patients to do, or should they be hiding away from research at the moment?
I think if patients are given an opportunity or see an opportunity or even are looking for an opportunity to get involved in research, then Bowel Research UK is perfect because it's patient-centred and it's well known. It's like looking to the future to help people like ourselves, like me, Neil, Leslie and others who are patients now, but we're also patients of the past, but we're able to, through engaging in research, you're able to help patients of the future, possibly people that haven't even been diagnosed yet. So I think, it covers so many positives that I would say if you have the opportunity then please do.
Leslie, if I'm a new patient and I'm either coming into hospital for my first appointment, so I'm coming into hospital for my first ever operation, is the COVID surge leaflet still useful for me at that stage?
Yes, it does. It talks you through the process of what you could expect in general terms if you're considering surgery. It talks about the steps in the process as well. And also it talks to you about how it has changed in COVID times and that you could expect to have some virtual meetings as well as face-to-face. It also talks to you about the questions you can ask about what to expect on entering a hospital. It talks to you about how the nursing staff and the health professionals and the consultants could look different because they will be wearing full PPE. It explains to you what that actually means in reality. And it does talk about the risks of coming into hospital and how the hospitals are working to mitigate against those risks. We have 3 booklets. One goes into a lot of detail to help really set the full range of questions and areas that you may have possible concerns about. There's another one that is like a basic user guide, which allows you to read that and think about what questions you would like to have with further telephone or video consultations and what you want to think about before you go in and when you're in. And the booklet also talks about what you can expect on exiting the hospital after surgery, who you could meet, self-isolation, if you tested positive, etc. So it's really very much there to act as I was going to say a second pair of eyes to help support you in thinking about questions that you would like to ask, because you may know a lot of the questions, but you may not know all of the questions. And that booklet there is really there to give you support, to give you the reassurance that you can come into hospital to have safe surgery.